Hello, I'm David Charles, Chairman of the Alliance for Patient Access. Approximately 3 million Americans are infected with hepatitis C. The virus progressively damages the liver and increases the risk of cancer and diabetes. It can also lead to liver scarring and cirrhosis, causing significant health problems and even death. Since 2013, a new series of medications has offered something radical, a 90 to 99% cure rate. But government and private insurers must be mindful to spend healthcare dollars wisely, and these new hepatitis C cures present real challenges. Even though new hepatitis C cures are very expensive, they could decrease cost long term. For example, they can reduce the need for expensive treatments for late-stage disease, such as liver transplants, which can cost more than $500,000. To keep short-term costs down, state Medicaid systems and some insurers have developed coverage rules for hepatitis C medications. For example, some patients will need to qualify through an extensive prior authorization process to get their medication. Such processes can include over a dozen individual requirements. Some coverage systems limit medications to only the sickest patients, those who demonstrate stage 3 or 4 liver fibrosis. Physicians may question the ethics of making patients wait until their livers are highly or irreversibly damaged before they can get the medication they need. Another challenge comes in the form of high copays. Patients may be asked to pay out of pocket for as much as 25% of the cost, which can run $84,000 or more. This creates an impossible financial barrier for many people. Society would benefit if all patients with hepatitis C could be cured, and public health would benefit by limiting further transmission of the disease. But given the cost of a cure and the number of people with hepatitis C, states, insurance companies, and employers simply cannot afford to cure everyone. That much is clear. Therefore, we must all work together to make a cure for hepatitis C accessible to as many patients as possible. In determining a solution, policymakers should consider several key factors. Insurance structures that allow treatment yet also remain sustainable. Mechanisms to drive down the cost of hepatitis C medications. Copays that don't impede access for patients who need hepatitis C treatment, and the need for patients to take their medications as prescribed. Medical researchers have produced a cure for hepatitis C. Now policymakers and other stakeholders must produce solutions for making that cure available to as many patients as possible.